If you've watched our other videos, you know that we're huge fans of having positive conversations about sexual health. It's important to get these conversations started with your children as soon as possible. In a perfect world, we'd start with babies. However, whether your child's 1 or 10, you still have time to bring up this subject. I'm going to give you a rough timeline of when you should bring up certain topics. Keep in mind, these are just general developmental timelines, which may vary depending on your child's cognitive abilities. However, even if your child has developmental delays, you can still offer them the same information. What's going to change is how you teach it. With that said, you are more in danger of offering children too little, too late, than too much, too soon. So try not to worry. If you tell your child too much, their eyes are simply going to glaze over. So start with babies, if you can. Every child is eager to learn the parts of their body. So when you're diapering or bathing, just name all the parts of the body, like the penis and the elbow or the vulva and the knee. If the baby happens to touch their genitals while you're diapering or bathing, just let them know that, yes, that is your vulva or that is your penis. By not panicking and slapping away their hand, you're giving them the message that it's a natural part of their body. Just name it appropriately and carry on with whatever you're doing. That does sound pretty easy, doesn't it? With toddlers can learn the same as the babies, learning the correct body parts. You can also start teaching them the basics of privacy and consent. Many toddlers at this point learn to touch their genitals, and usually in awkward situations like in the grocery store. By telling them that it's okay to touch themselves, but only in private, you get to address this issue without shame, while also reinforcing that some things are best left for the privacy of home. Clearly, the grocery store is not private. Perhaps you could say that their bedroom at night is a much better time. Toddlers and preschoolers are also going to begin wondering where babies come from. They may see a pregnant woman, or they may have a sibling being born and wonder, where do babies come from? Where did I come from? And this is a great time to say that babies grow in a womb or uterus. See, that was easy, right? You didn't have to cover anal beads or vibrators. You got this. So this answer is probably going to satisfy them. It may not. They may ask a follow-up question. Find out exactly what they want to know. This is probably not the best time to get into details about the fallopian tubes. You'll discover information may have to be repeated in order for it to be learned. To be patient, because this just means that the learning is being processed in the child's mind. And this is especially true if your child has learning disabilities. Please resist the urge to say things like babies grow in tummies or babies come from the Cabbage Patch. Many children get the digestive system confused with the reproductive system, and you also don't want to have to tell your child down the road that you've lied to them. And yes, at some point, your child will want to learn how babies get into wombs. Depending on your child's age and interest, you can start discussing eggs and sperm. And if you're not sure how to describe this effectively and simply, just get a storybook to do it. There are many great books out there that do all the detailing and explaining for you. And just read it at bedtime, and of course, read it many times because repetition is really important for young kids. You may want to emphasize that talking about sexual health and genitals is a private conversation you only have with your parents at bedtime or bath time or any other boundary that you'd like to set. Otherwise, you may get children asking at the library if a stranger has a penis. So remind children that this is a private conversation, but not a secret conversation. It's okay to talk about sexual health in private with someone you trust, like your parents. Puberty can hit children as young as grade 3 or 4. Ideally, you bring up the body changes before this so that children aren't frightened by it if they happen to start menstruating early. Menstruation and wet dreams can be quite terrifying to children if they don't know what's happening. So when is a good time? Perhaps your child comes across some tampons in the bathroom, or perhaps while you're watching TV, the topic of wet dreams comes up. Or if you want, you can read a storybook that talks about puberty so children know what to expect when it comes to them as well. As puberty arrives, it's a great time to start talking about healthy relationships and the beginning of sexual activities. Again, use teachable moment. Perhaps you see a package of condoms on a store shelf and you use that moment to tell your kid that they're health supplies that help reduce infections and unplanned pregnancies. They should know the basics about protection and consent, even if they're not quite ready to engage in those relationships yet. As your children reach junior and senior high, hopefully you've had lots of conversations with them about the basics. By this time, you should start learning about much more complicated topics, like pregnancy prevention, sexual violence, sexting, pornography, and more. These conversations are not always easy, but they will be more difficult if your youth don't have an understanding of how pregnancy happens or what kind of sexual activities actually can cause an infection. Don't beat yourself up over it if you haven't started yet. It's not easy to chat with our children about sexual health because we usually do fear that we're going to tell them too much too soon. Don't panic. There are a lot of great resources out there no matter how old your child is. No one's born a sexual health educator, so just start learning about the topic. My best advice is go to the library or your local sexual health center for a book and get started.